So I'm Peter Wallace. I'm an Australian in Singapore getting proton beam radiation therapy for cancer in my throat. Good morning. So I was diagnosed with cancer in my throat. It's a squamous cell carcinoma, P16 positive. The outlook was for 90 to 95% survivable, but I was likely to have some significant side effects from radiation treatment. The doctors in Australia told me that I would likely have a dry mouth for the rest of my life. I could have trouble speaking, trouble swallowing. I could potentially have food and liquids going down my windpipe when I eat, and a damaged thyroid. So the side effects were very significant, very worrying, and I started looking around at alternatives, and I quickly discovered proton therapy was available in other countries and not Australia, and so I've travelled to Singapore to get the technology.
To ensure accurate treatment, we need two staff to execute the treatment. One is reading out the parameters, and another one will counter-check the parameters. Once all this correction is already applied, so we will then prepare for proton treatment.
I actually haven't had any pain. I had my last proton beam treatment today, and I'm not in pain right now. So at rest, I have no pain whatsoever. I haven't even been taking Panadol. Sometimes when I yawn, my throat hurts a little bit, but it's not enough to even bother taking, low-dose Panadol.
There have been some head-to-head comparisons showing that proton beam therapy is as effective but less toxic than a photon or X-ray therapy. And so this is the approach that we've started to do in Singapore since 2023 when we started our proton therapy service. So this was an option that I think most suitable for patients like Peter with a fairly small disease burden, with a high cure rate, and also fairly young. So we really want to maximize the cure rate but minimize any potential long-term or short-term toxicities. So it's not that the proton beam therapy doesn't cause side effects, but the severity and the duration of these side effects will be shorter compared to photon or X-ray treatment.
The experience of the mask coming on was a little bit intimidating at first, and I'll admit I was a bit uncomfortable in the first session, but I got used to it. There's a little bit of pressure on my teeth, which was causing some discomfort, but it wasn't so bad that I couldn't bear it. It is uncomfortable, but it's not unbearable, and you do get used to it, and you just have to learn to relax a little bit, and before too long it's over and done with.